Wow, Enid is here.
How are you, Miss Fran?
Wow. Good evening, everyone. Oh, I'm in the morning time in the Caribbean. I need to change this. Hello, everyone. Miss Love, good night. Rashida, is Monica.
Hi.
Karen and Karima. Good night, everyone. So sorry for the delay, for keep you all waiting. I was waiting for the host to let us in. It is so good to see you guys. Enid, I've missed you. I've missed seeing you. I've missed talking to you.
I miss you too, Miss Fran.
It's so good to see you, and
Me
welcome
too.
everyone. And Miss Rashida, I must tell you that I was giving you up to the ending of November, then I was sending the squad for you. Uh-huh.
Hey, keep in mind, man. I know a lot of us. Keep in mind, I'm a parent. That's it. That's all I gotta say. I'm not making excuses. I'm juggling. We were all juggling. I know we were all juggling.
Miss Love, it's good to see you.
Thank you. Good to see all of you as well.
Okay, so I know it's 7 and Miss I don't know how to pronounce the last name, so I will say Monica or Monique.
Monica is fine. I know the last name is a little bit difficult.
Yeah, I don't want to murder your name and I don't want to bite my tongue, so we'll leave it as that.
That's good enough.
Good night, Dante. Good night, Warren and Karima. It's good to see you. So we will dive right into it. Let me just print my agenda. I've had a really busy day, so I understand. In the meantime, since we have persons we don't know, I will ask for you guys to introduce yourself to each other whilst I print this. Rashida moved away, so Miss Love, can we start with you? Introduce yourself. Okay, so Rashida, introduce yourself. I'm going with who I have on my screen. So introduce yourself, your organization, and then we'll go from you to everybody else.
Hi, everybody. I think I met some people here. So my name is Rashida Sykes. I am currently program manager at the Phoenix, which is a national sober active community. So we do a lot of fitness activities and yoga and all kinds of stuff. I'm also a board member of Plegna, which is Prospect Lefferts Gardens Neighborhood Association. So it's based right out of PLG, right here in Flatbush, PLG. And I'm also an MSW social worker by education and trade. So nice to meet everybody. Nice to see everybody here today.
And you are a CB9 board member and a member of the Health and Social.
Yes, CB9 board member and committee member of the Health and Social Service, right? Sorry, this is my first time.
Okay, Miss Love.
Hi, good evening, everybody. My name is Jacqueline Love. I am the founder of Grandma's Hands Incorporated, a nonprofit that serves our senior citizens in underserved communities, as well as co-founder of Food Foundation. And we do food rescue and bring healthy foods to food deserts. I currently am the director of senior services and support with Bridge Street Development Corp. And MPA, social worker, 22 years of city service prior to this. And I'm on the Community Board 9, and I serve on the Health and Social Services Committee.
Thank you so much, Monica. So Monica, okay, go ahead. You just give a little something, just introduce yourself, because I know you have to do a presentation.
Right, I know under 5 minutes I was told. So my name is Monica Sherjay. I'm a nurse, emergency room nurse for over 20 years. And
So
I'm
we'll be
gonna be,
coming back. We'll be coming back to you so you can give us your presentation, and we will know more about your organization.
thank you.
Enid.
Good evening, everyone. My name is Ina Dillard. I am the Director of Marketing and Public Affairs at One Brooklyn Health at the Kingsbrook campus. And I also serve on the Health and Social Services Committee. It's my pleasure to be here tonight.
Our distinguished DM.
Thank you so much for that. Hello, everyone. My name is Dante Arnwine. I serve as the district manager of Brooklyn Community Board 9. It's a pleasure to be with you all this evening. Yeah, and I look forward to working with this committee on its endeavors. This committee does a lot of good work, so I know that a lot of good discussions will come from this committee. So you have a phenomenal chair. She's very good, even though she likes to play tricks on me. And I don't understand her jokes sometimes, but she's good people. And I look forward to working with the committee.
Thank you. Thank you. So Karima.
Okay. Hello, everybody, and good evening. My name is Karima. I am still a grad student at SUNY Downstate Medical Center. I'm in the Masters of Public Health program, and I am also part of Community Board 9's Health and Social Services Committee. And I currently work for New York Health and Hospitals with the COVID pandemic contact tracer initiative.
Thank you. Our first vice chair on the board.
Hi, everybody. My name is Warren. I'm the first vice chair of the board.
We can hear you. I'm not sure if you're in Australia, but we can't hear you. Yeah, your volume is very low. While you work on your volume, we'll come back to you. Ms. Smith, can you introduce yourself, please? Karen Smith.
Hey, hi everybody. My name is Karen Smith. I'm the outreach director for Oak Street Health over in Flatbush. We're a primary care office for our seniors. First, want to thank you all for putting our flyer out for our big senior resource fairs tomorrow that we'll be having. We're doing a lot of giveaways. It's going to be a pretty long day. I'll be there from 7 a.m. packing produce bags, but we have coats. We're going to have hats, gloves, fresh produce. We actually also have the cell phone people coming, as well as the ones that are giving away tablets. So it's going to be a great day for the seniors. And again, thank you so much for having me on there.
Thank you. Mr. Burke?
Hi, everybody. I'm Warren Burke. I apologize for that. I have a new
You are still low, though. You are sitting high, but you are low.
Oh, damn. Hold on. Okay.
So whilst we are waiting for Mr. Burke to adjust his volume, I just want to take this opportunity. I would like so much to thank Miss Love publicly. I've done it, just the two of us, but we had our wellness fair on the 2nd of October, and Miss Love made it happen for us. Miss Love was able to bring in close to 200 bags of food to give out to the community. She made it happen. And we just want to thank you. From the time I was connected with her, she just went and had in everything in and make sure that it happened. And we just want CB9, myself and our committee, we just want to thank you so much, not just for what you did for us, but what you are doing in the community, what you are doing for people. This is just a true testament of removing self and just giving back. So we just thank you. And I just hope that we sitting here, and I'm saying that so our DM and our first vice chair could hear that we can publicly honor you, do something for you to show our love for because of what you do. We're so thankful. You have a big heart. Thank you so much. I know you said that your grandmother started this and you continue it, but I think that whatever seed she planted, the roots went really deep. Thank you.
Thank you for that. Thank you for that. And if you want to continue to support the work, our 7-year anniversary is coming up on Tuesday at Nostrand Social from 6 to 9. And we have Governor Kathy Hochul as the keynote speaker. And my brother and community partner, Marlon Rice, is the host for the evening. We're asking for an $85 donation, which includes your food and open wine bar. But if not, you feel free to donate. All right, I'll make sure to get you the information and the link, Ms. Leopold, so you can share with the rest of the committee.
Definitely, definitely. Mr. Burke, are you ready for us now?
Yes, I think I am.
All right, all right. You're back in the US now.
I have new earbuds and I have to tell you that I am having difficulty with them. Seeing I'm a senior and that brings me to Oak Brook, which is very welcomed in our community. And I can't wait to dance on Nordstrom Avenue on Friday. I do want to give a shout out to Carmela Comluglia, who and Miss Love, #1 for the produce, but more important, no, but as important, Carmelia, who sat there with it all day. And I'm going to not mention how carrying 450 bags of produce a half a block does take a toll on a person. So thank you all.
Yep. Karima, where are you? Karima?
Yep, I'm
Okay,
here.
so I want you to show your face. Now, this young lady here, from inception, she joined the Health and Social Services. From the time I became the chair for Health and Social Services, she's been coming to the committee meetings. Mind you, she is not an official appointee on the board. She's on the committee, a resident committee member. Mm-hmm. And whenever she could be there, and we had this wellness fair, and she stayed, we had all the food at the church. I had to go to the church to call her and say, hey, you are not the security guard for the food. Come out, do something. Go down the street, meet people, do something. She sat in there. I just said once, I said, I don't want people coming in and messing up with the food. Can you sit there? And she did not move. And I would see her down the street, and by the time I turn around, she would be gone again. So I just want to say thank you. Thank you so much for your dedication. Thank you for your dedication to the committee, and thank you for all you did for us on at the wellness. So thank you so much.
Oh, you're very welcome.
Just give me 1 minute, please. Sorry about that. Okay, so let's move along because it's already 7:20. There is a young lady, she's not with us here tonight, but she did a presentation, and her presentation, it really entails going to the schools and teaching the kids and parents how to cook healthy, right? And it is something that we're looking for. I was hoping that she would have been with us tonight, but she's not here. And it is something that I wanted the committee to discuss that, but I did put this on the agenda first, not knowing that we had a presentations. But so before we go into this and before we discuss, I would like to give the floor to Monica so that she could give me a little bit more or do a short presentation as to what services she have in the community or she's bringing to us. And also after her, I would like to hear a little bit from Ms. Smith as well. So Monica, welcome, and the floor is yours.
Thank you very much. So I do have a PowerPoint.
All right, give me 1 second. I was just about to ask you that. All right. Let's see. Yeah. All right. So if you look at the bottom, Monica, your share screen button should be there.
Yes.
All right, good.
Okay. Are we ready? Okay. So, good evening, esteemed members of the community. Like I mentioned before, my name is Monica Sherjay, and I am emergency room medical professional. And I am seeking today to open a drug and alcohol addiction rehabilitation center named Under Angel's Wings Recovery Center. As part of OASIS accreditation, which we are in the process of seeking, community acknowledgement is a minimum requirement to move forward with the project. Out of respect for the community, I am also seeking full approval and support to assure that the recovery center would be welcome and most of all beneficial for the community. Our goal at Under Angel's Wings practice is to provide professional and dedicated service that builds hope, healing, and renewal to those impacted by addiction. Through hands-on, integrative approach, we seek to heal clients physically, mentally, and spiritually, to repair family dynamics, and to create resiliency and strength for the future. We are not affiliated with a religion. We are committed to serving people of all races, sexualities, and gender, and offer support regardless of the immigration status and ability to pay. Under Angel's Wings will offer comprehensive, science-based, and individual support. We're gonna have treatment that will include cognitive behavioral therapy, individual and group therapy, family and couple therapy, and medical support. Question arises, benefits to having a new recovery center like Under Angel's Wings in your neighborhood, which include direct serving members of community who are impaired by substance abuse, as well as their families and loved ones. Preventing and reducing death, injuries, incarceration related to substance use, which threatens families and social networks in a community. I think in addition, a private rehab center can take some of the load of the local hospitals, which are especially overwhelmed in our current health crisis, as we know, during the coronavirus, addiction, drug overdose increased drastically, which I see every single day. Mothers are dying, fathers are dying, children are dying. I'm getting more and more younger population struggling with depression and anxiety. It's extremely painful and sad to see what's happening in the hospitals. And finding local treatment center may also make enormous difference in recovery by simply reducing travel time for patients. I am speaking with you all today as part of my research to finding the right location for Under Angel's Wings new recovery center. In doing research for this presentation, I came across two community health profiles. One community profile was from 2015, another one was from 2018. So the one from 2015 is stating that South Crown Heights and Lefferts Gardens ranked 19th highest in New York City for alcohol-related hospitalization and 16 for drug-related hospitalization. In the profile from 2018, they didn't mention anything about substance abuse. but statistics, they show statistic regarding to psychiatric hospitalization, as well as moderate issue with hepatitis C and binge drinking reports. I think this statistic indicates that this district could be still in need for support. As some of this information I am aware that may be no longer accurate, I appreciate the committee members' own thoughts on the need for rehabilitation center. Whether these are in fact still ongoing issues in the community. My interest in this project stems from my experience, like I mentioned before, working for over 20 years in medical professional environments. Every day, I actually witness firsthand the damage drugs and alcohol addiction has on our Brooklyn community, on individuals and most of all also families, because families are always part of the vicious cycle. In my personal life, I will share, I have supported a loved one who has struggled with addiction, which has gained me additional insight to the process from the other side of the clipboard. Most of all, I have deep respect for all people of Brooklyn and New York, and I want to do my part in service to the community. I appreciate everyone for your time and attention to this topic. I appreciate hearing your questions and concerns or any comments or guidance that you would have for me. Thank you.
Okay, so the floor is open. Anyone who have any questions for Monica, please do so.
Hi, Monica.
Hi.
Thank you for your presentation. So I just wanted to ask, is this going to be an outpatient, like clinic style?
Yes, this is going to be based on outpatient clinic. It's not going to be inpatient. It's going to be certain hours that the rehab is going to be available for all individuals as well, their families.
Okay. All right, thank you.
Hi, Monica, I have a quick question. So you're looking to bring the recovery center to CB9. Do you have a tentative date or month or year of when you would like to bring the recovery center to the district?
Hopefully it's going to be sometime the beginning of next year, because like I mentioned before, I am in a process of getting accreditation by OASIS, and we are trying to find the right location. And I want to make sure that I am in the community, that I can make a difference, that I'm going to be welcome, that I'm going to be supported by community, that together as one, we can make difference.
Hi,
Do you think about also, I'm sorry, because I know that sometimes outpatient programs will also have like therapy services on site and they have the other portion on site. Is it going to be a combination of that or just strictly case managers on site?
I am fairly new to researching the base approach for individuals. For sure, like I mentioned in my presentation, is going to be individual, group, and family therapy. If there's going to be other services available, I cannot decide at the moment, because everything has to be completely approved by OASIS. I am not sure which therapies they're going to be actually willing to approve. And also, I was hoping from feedback from all of you and suggestions, what could be beneficial, because I can always approach OASIS with new ideas.
Okay, go ahead, Warren.
First of all, I just wanted to tell the committee what OASIS is. in case you don't know.
Mr. Warren, you went back to Australia? Whilst we are waiting for Warren to come back, I am very happy with your presentation. I like, you know, what you'll be bringing to the community. Because whilst you were talking, I'm thinking and I'm having this vision. You know, you're seeing so many young people drinking, you know, and smoking. It's just like it's that it's like it is a comfort, you know, like when you're feeling sad, you just pull up a jug or a thing of ice cream, and you're
Like
just
a comfort food kind of thing.
comfort food, exactly. And it has become a comfort food for young. I mean, you used to say the older folks, and when I walk down North Street, I'm like, oh, really? You know, and it's just like it's really bad in our community, and our people, they're stressed. They don't know how to cope with the stress, and they think alcohol and the drugs, and I mean the drugs have been there, but when you see the young people drinking, it is really heart-wrenching to see that. So hoping to hear the decision is just not on me, but the committee at large, as to how they feel with this new idea that you have to come. And I think it's a great idea, because whilst you were speaking, I started thinking of we have, and it's not been showcased out there, and I think it's been around so long that persons are just ignoring it. And AIDS is really rampant in our community among young people, and it's not being mentioned at all. It's just like people just think, well, it's been there for a long time. Let's deal with it, you know. And a lot of our young persons are affected, and now I know many of you who know that this has been affecting our seniors in the nursing homes. You know, seniors in nursing homes, they have been affected with AIDS, and it is something we also have to address. But we just have to take one step at a time. And I just want, as you are out there and then you see whatever is happening out there and how we could help, just bring it back to the community. And I am so happy for our DM, because he's open, he's supportive, and our first vice chair, although I don't know why he's going to Australia tonight, but he's very supportive, and he's there and he wants to, you know, everything that we are doing, you know, he's very supportive. And we really want to make a difference. We really want to help our seniors, and I'm very happy to hear Ms. Smith is there and she's working with the seniors. So I know one person, Rashida did ask a question, but Warren, are you ready now?
Yes, can you hear me?
Welcome back, my dear.
All right. Number one, we appreciate any help we can get. Number two, I just wanted to explain to the committee what OASIS is. OASIS is the state mental health division. And essentially, in terms of addiction over alcohol, OASIS is the person. So while New York City may have a Department of Mental Hygiene, okay, OASIS is the one who certifies these organizations. Number two, and I'm totally supportive, but I don't get what your target is. In other words, are you, Monica, are you targeting families? Are you targeting individuals? You know, I just don't get it. One of the major needs we have at this point in our community is for detox. So where does this all stand?
Okay, so the outpatient program will not have detox like some of the facilities. They have 3 to 10 days intensive detox. We might be doing detox based on an outpatient program, people that are not going through active withdrawals, that their health is not in any emergent dangers. Am I targeting individuals? Both individuals and families, because I feel, and like I mentioned before, I experienced as a family member that it doesn't only affect the individual, it affects the family as well.
So my
Okay,
question to,
so
oh, sorry, Warren.
I'm
Go ahead,
I'm
Warren.
not finished. I'm in Australia and it's costing a lot of money to call in, okay? So what would you like us to recommend? In other words, everything is this, that, and I say that respectfully. So what would you like us to recommend?
I want to know from the community members, do you feel that outpatient rehab in your community would be beneficial? Would I pretty much have your support? Will I have your blessing? Or do you think that this is something that your community does not need? I want to be there to make a difference. I don't want to be there as a business. I want to be there as a change in the community. I want to
Okay.
feel at the end of the day that we are making difference.
Monica, and thank you for that. We need all the help we can get. But the question is, if you want us to write a recommendation to Oasis, what do you want us to say?
If you are in favor, if you will agree or vote that you are in favor, simply that rehab and the Angel's Wings will be welcome in your community.
Okay, thank you very much.
Thank you.
So, go ahead, Dante.
Okay, just a couple of questions. So you said that detox probably would not be at the recovery center. So would you guys be like offering referrals? Like, would you be able to refer people to the necessary places where they could receive detox?
Definitely. I work in emergency rooms, so I do have contact with a lot of social workers located in emergency room. And we do this all the time. We treat the emergency and then we refer people to local detox facilities. So that's something that I will work on it, but definitely referrals, I will get connected to close detox centers and we'll try to work with them.
Thank you for that. Next question is, what type of insurance will you guys take?
The insurance has to be approved, but it's going to be mostly all insurance, private or Medicaid, Medicare, also hopefully sliding scale for the people that, like I said, cannot afford and they do need help. I'm an immigrant. I came in 91 from Poland. My cousin, the person that struggled with addiction, not long ago, it was very difficult for him to get help. And a lot of times is because of the insurance, because some rehab centers, they do not do sliding scale. I want to make sure that everybody will have a fair share in getting help.
Okay, thank you for that. And my last question / statement, I guess, is, and just tell me if I'm wrong. So, you know, you're here before the Health and Social Services Committee, and you're taking feedback and suggestions to build out this recovery center that you want to bring to the district. So, would it be fair to say, like tonight, you're taking information, you're taking ideas, and then you would hopefully or possibly be able to come back maybe in like December with like a structure or a plan of how exactly the center will look like with the included suggestions from the community. And then maybe at that time, the committee itself would have those discussions about, writing a letter of support.
Yes.
Is that what you're looking for?
Yes, sir.
Okay.
Yes.
So I appreciate that. I just wanted some clarity. I also wanted to say thank you for attending the board meeting before you've received the appropriate accreditations. Usually what happens is people come to the community, they open, or they're like on the brink of opening, and then they come to look for the community support. And you have done it before you've even received the appropriate accommodations. So I think that that speaks volumes to your professionalism and what you're trying to do in this community. And I want to thank you.
Thank you so much, Dante. Anyone have any questions or suggestions? Go ahead, Ms. Love.
Okay. I don't know if I missed it because my kid was in here talking, but I wanted to know if there's a plan to recruit KSACs locally. I want to know if KSAC classes are going to be offered to, let's say, graduates or people who have completed, the outpatient treatment, and also if you're going to facilitate AA and or NA meetings on site.
The NA or AA meetings on site could be doable. I'm gonna have to also find out the location, what hours gonna be approved. Would I like to recruit locally? Absolutely. That's why I'm reaching out ahead of time to the community. Is gonna be our rehab center. So local people, KSAC people will be welcome. There's not going to be no training or classes available for them because I am not certified to give classes to KSAC people.
I'm just going to piggyback. Oh, go, Ms. Love.
I was just going to say thank you for your response. That's it.
And I'm not a medical professional. I don't work in the medical field, so I don't know what KSAC is. So if you're unable to provide that, will your recovery center refer patients to those services?
We will have counselors that are certified in addiction programs. So they will be certified, absolutely.
Okay.
And that is mandated by OASIS, by state.
Understood. Thank you.
For clarification, the KSAC is the Credential Alcoholism Substance Abuse Treatment Counselor.
Thank you.
All right.
Thank you. Karima, you have a question?
Not really a question, but I think the presentation was really good, and from what I've seen in this part of Crown Heights or Southern Crown Heights, the COVID pandemic really did a number on a lot of people, and a lot of people tried to cope in their own way, which unfortunately a lot of them go to more drinking, smoking. We all have our coping mechanisms, some just not so healthy, but I do think that we do need more services where mental health is concerned in Crown Heights, because I don't think there is nearly enough of them as need to be, and also to target addiction and substance abuse as well.
Yeah. And one thing that I'm very concerned about is also the service, because sometimes you have businesses or whatever institution it may be, they come in, and I don't want to go that I'm already suffering, and when I come and I walk through your door, I'm experiencing extra pain. So patient care, the interaction, and it is something that sometimes you bring in people to work, and the job that they're doing, it is just a paycheck for them. But the level of empathy is very, very low. So you're coming through and their interaction with you and whatever. So when you find persons who are already going through stress, and as Karima rightfully said, we have young people who've lost their father, they lost their mother, they lost their uncle, their aunt, a whole family members, they lost 5 members of their family. And this is how they're coping, drinking, just to bury the pain. But when that soothness or when that comfort wear out, it comes back again. And if your facility is coming, it's very important. But we want it to be a place that when you find patients coming in and if you have counselors, whoever is talking to them, that when they leave, that they want to come back again. And they want to be able to tell somebody else, you know what, they have this place, they opened this place there, and I went there and I felt comfortable. I was treated with dignity. They spoke to me, and I felt good, and I always look for that. And when I have round tables with Cornell doctors, I always tell them so. Patient interaction, persons in the healthcare field, they have to learn how to deal with people, how to talk to people. So the persons that you're bringing in, I know that you are not the one training them, but it is something that in this community, if I'm wrong, the others that you could let me know. If somebody walks through that door and you treat them bad, they ain't coming back again.
True.
They're going home and deal with their pain by themselves. They say, what's the point for me to go there? So we just want to make sure that even with everything that you're getting, everything that you will put together, you put your package together, you present it and what you are hearing now, the majority of persons here now, they are in favor with you coming, they're in favor of what you're bringing to the community because it is needed. But then there is much more when it comes, to go with that. So we just want you to take that into consideration.
If I may share with you, when I was trying to get my cousin into rehab, I think what was the most painful for me throughout the whole experience and what really affect and, my well-being, number one question was, what insurance does he have? There was no question, how is he doing? What help does he need? Do you feel that he's going to be okay with the outpatient? Can we help you with assisting you, with other names of the rehabs? None of that. Number one was what insurance? And then a minute he would try to talk to them would be, some of the places would say, oh, he doesn't speak English enough. And that's painful. No matter if his English was perfect or not, he's a human being and he needed help. And every situation could be always resolved in a different way. When a person is asking for help, they should be helped. Regardless, if they speak English, they don't speak English, if they have insurance or they don't have insurance. That's why the name is coming, kind of, originated, and the angel's wings. When they are falling, I want to make sure that my facility, my rehab is going to be able to take them under the wings and help them when they are not able to help themselves.
Nicely said, nicely said. I think that I'm not going to talk about the presentation, but I think that was one of the concerns Warren had. We had someone who made a presentation and everyone were really in favor of they're coming into the community. It's totally different from yours, but close. And the two of them can work together. They can really blend together. But that's one of the things Warren was concerned about, that it was not all about insurance of the monies that you could make. And that is a great point that you make, because a lot of facilities they would open and the first thing they don't ask you how you feel and how the first thing they talk about is insurance, and it's a big turn off. So I'm so happy that you mentioned that. So as the DM have said, whatever information, if anyone else would like to share, because it's already 10 to 8, what anybody else who wants to ask a question and make a comment, please do so. Or else, then I'll go to Ms. Smith and give her 3 minutes or 2 minutes to tell us about her and what services she have in the community. So Monica, I'm so happy that you are here. I'm so happy that with your presentation, our presentation, it was excellent. But you can go back, whatever you took from us. If you need to ask more questions, you can reach out to Dante, and and then he will give you any information that is needed to put your package together. Because you come in here now, this is for the approval for you to present to the general board so that you can get your letter of approval. For us, I know all of us here, I mean, if there's anyone else who's not in agreement and you don't approve, please put up your hand if you don't approve. But I approve with what you're bringing to the community. I think that it will do well in the community. It's needed. Okay, so we're looking forward to you. We are looking forward to you presenting at the board at the next board meeting. But whatever that you have, any information you have, any information that is needed to put your package together, please reach out to the board and definitely you'll get any help that is needed. And thank you so much for coming.
Thank you very, very much. Thank you.
You're welcome. Ms. Smith, the floor is open. Can we hear from you, please?
Hello, can you guys hear me?
Yes, we can.
Okay.
I think you didn't go as far as you didn't go as far as Australia. I think you're in Long Island, so we can hear you.
Okay, I don't really have too much to say. Just basically what we're trying to do right in the community now is just have awareness for the seniors. We did a presentation this past Sunday at St. Gabriel's Church right over on Hawthorne. It was streamed on Facebook as well. So we were just letting the community know in regards to the importance of primary care and just having it accessible. So each month we are allowed to have new patients added to our doctors panels. We provide transportation to and from as long as they're within a 2-mile radius, and it costs them no extra charge, and it's not accessorized. It's actually our own transportation that picks them up. We help coordinate their specialists if they need help applying for additional assistance, whether it's Medicaid, LIS. We have those services there as well to help them get those additional benefits. And we're growing, but specifically for this community, we know that there's a large need, especially for our seniors, because we see them at City MD and Kings County. And my job is just to bring as much awareness as possible and have as many partnerships as possible so that the seniors can have primary care physicians that take care of them.
Well, Ms. Smith, I'm very happy to hear that, and I'm looking forward not to really to work with you, to have you back on the committee and be part of our committee, because that's one of the things that I'm looking for persons to work with, because we have a large population of seniors out there, and there's so much for them, but they're not getting the services that's out there because some of them, they don't know of the resources that's out there for them. And I'm very happy with what you're bringing here. I work very closely with the board. We work closely with St. Gabriel. We work closely with Christopher Bledman, Shalom. But Shalom, they go a different way. They do stuff differently. And we work with Fenimore, and there are other, and then also we're trying to penetrate Ebbetsville, you know, so because there's a wide representation of seniors out there also. So I'm looking forward to working with you closely, because we have Brookdale Hospital, we have Kings County Hospital, and we have other little places in the community who, you know, that our seniors, sometimes they are not able to get to those places. Even during COVID, our seniors were not able to get the things that they needed. And we had even Department of Age in the city try to work with our seniors, sending home food for them. And then some of them, they could not use the food that was being sent for them. Some of the food were packaged food, frozen food. And then because the salt contents in those food packages, they could not eat the food. Some of them, I mean, there are so many of them that there is this agency, I'm not sure who they are, I don't remember the names, but they offered free services for the seniors to do the shopping, pick up the medication, but there are so many of them, they just couldn't keep up with all of them. You know, so these are some of the services that we are looking, you know, to help, because a lot of them, they don't want to go outside. They still they're fearful for COVID. They don't want to leave home. And we are really looking, so you're saying that they could get transportation for them,
Yeah.
to go to the places, go to the doctors, and that is such a good thing, because some of them, they rely on accessoride, and accessoride sometimes take forever. They may have an appointment at 2 o'clock appointment, and this accessoride will get there at 3 o'clock. And when they get there, the appointment time is gone, or else they have to sit another 2 hours. So we have to do better by our seniors. We must do better by our seniors. So I'm very happy with you being here tonight. The board, did you heard of our meeting through the board, right?
Yes, I was on it last week all the way up till about 10 o'clock, and I had to go to bed. But yes, I did attend.
Okay, okay, good. So you can get my information through the board, and I'm inviting you to join our committee, so we can talk some more and some of the services, because even on the general board meeting, we have seniors who come, and then those information will be very vital for them to get as well. And then Miss Love with a wide population of seniors out there, and she is here. So I'll be very happy for you to be part of this group, because we have,
Thank you so
oh,
much.
all right. So thank you so much for coming. Thank you. Yes, Miss
Absolutely.
Love.
I just wanted to say that we have a partnership with Mega Evers, and we serve the seniors in Ebbets Field. So on November 17th, we're going to be going over to Ebbets Field to do a food and basket distribution. So if Ms. Karen, if you're available to come out or have someone come and table with some information, about the services that you all provide, it would be welcome.
That would be awesome. Yes, I did. I sent an email for Ebbets Field to let their building know that we're having this tomorrow. So yes, you said the 17th. Absolutely.
Yeah.
I don't know if there's a chat here, but I can definitely, if all of our emails are in the email chain, I'll make sure that I send you an email with my direct information. We would be happy to come out.
Thank you.
Yeah, Miss Love email is in the email chain, so you will see it, and then you could send her an email. That will be great. Thank you so much.
Thank you.
You made my night. I am passionate about our seniors, and and some of them, because of how will I say, tricksters, or you go to the doors. So that's why now, especially those who live in the apartment buildings, I try to find ways that we can get to know someone who lives in the building, because they don't trust strangers. You go to the doors to knock the doors, they won't open for you, because they're afraid. They don't know who you are, because there's just so much happening out there. So I try to, especially like Ebbetsfield, the Tenant Association president, she's part of the board. So we can walk through her in order to get to the seniors at Ebbetsfield. But we have other apartment buildings in the community that you are not able unless you see them. And if you see them outside on the street and you try to talk to them, they watch you and they're ready to run, because they don't know if you don't know who is coming to mug them. So they are missing out on so much. So we have to find ways that way we can reach them, because they're a vital part of our community. We need them, and we need to keep them safe and keep them healthy. Anybody else who wants to share anything? I have more stuff on my agenda, but I cannot go through everything I have on my agenda for tonight, because this was very good. This was very good discussion. So everyone here, you're part of the committee. I'm not going to put any strain on nobody over the holidays. We have Thanksgiving coming, 2 more holidays coming up. And Thanksgiving coming, everybody trying to get out of town. And those who are not getting out of town, they're trying to get themselves ready. Then we have Christmas. So around the holidays, I will not be burdening down anybody for us to do anything. But we have to plan for January, February, March for the new year. And then I think our seniors, we have to start with our seniors. Any ideas you have, or anything that you wish for us to do when you go out there, you're the eyes and ears of the committee. Please come back and let's make it happen. Let's push. Let us just bring change. Let's make things happen, because sitting down, having meetings, discussing, it has not pushed the cart. We need to get behind the cart and push the cart. So Rashida, I know you're out there. I know you're doing your thing. I know you can bring some vital information back as to what we could do. Now, Miss Smith have accepted to be with us, so we can make this happen. And we have Miss Love, Enid, did we had this phenomenal cooking during COVID, and I don't think and even the young lady who cooked at the wellness fair, persons were really talking because she did the salad and whatever, the cold salad, and then persons had that, and even Diana left with a bowl. Miss Richardson, she left with a bowl with a salad to eat, and persons were saying that it was very good. So it is something that we can continue. I am looking also to have maybe not a monthly, but a quarterly health presentation also. So we can have somebody from Kings County coming in, then we have somebody from Brookdale Hospital or Kingsbrook Jewish Hospital. So we have person to come in. So I would like us to work with the DM, because just on this small scale, because what I realize is that we need to push some more. So if we have someone who's coming, because we have some very vital information on obesity and diabetes, but then one night, the only persons who were there was just the committee members. We had no one from outside. We just had the Kings County Hospital people and our committee members. So really, we had 8 persons there, and it was not good. It was not a good feeling at all. So when we do have presentations, we have somebody coming in, I would like for us to really work, push it out there, invite, our friends, send out the flyers, because the community board put it out there, the hospital, they put it out there, but we ourselves, the members, we need to play our part as well. We need to invite people, because the information that's been brought to us, they're very important information. I wanted it to be done on a wider scale with the board, but usually the board agenda is so jam-packed that the time allotted to them, it's not enough, because you cannot give somebody 5 or 10 minutes to give a presentation on diabetes or on obesity. They need at least half an hour, So I'm trying to work around that, but the first vice chair, the chair for the board, and the DM, we'll sit down and then we'll talk about it and see how we can make it happen. But there is so much happening out there. There is so much good health information our community needs to know about. They need to know, and you'll be shocked that we have persons who live right next to Kings County. We have persons who live right next to Brookdale, and things are happening there they don't even know, because people don't understand precaution is better than cure. And they wait, and when things happen, then they try to get information, then they try to get, the treatment. And then there is so much out there that could help us to keep ourselves healthy. So I am happy for the contribution tonight. I'm happy for the presentation. I'm happy for Ms. Smith joining us, and happy to see each and every one of you. You have the whole of this month and the rest of the year, December. Let's put our heads together and let's make it happen. We will not allow the bull to lead us. We're going to take the bull by its horn and we're going to lead. We're going to make this happen. Rashida, why are you laughing?
I'm sorry. No, I'm just laughing. The words that you use, I love your energy. That's all I got to say. But really quickly, off the top of my head, when I think of seniors, I think, I'm always thinking about fitness stuff, right? And so the first thing that comes to mind is senior fitness.
Yeah.
We do our bi-weekly walk every Saturday at Prospect Park, and it's really attracting more seniors than anybody come regularly.
Right.
And you'd be surprised, they're counting their steps. People have lost weight. Like, people really don't emphasize the benefits of walking, but during this walk, people have really lost weight, and they're tracking their steps. And so,
yes, send the flyer together and send it to the CB9.
I'm gonna send it.
And yeah, please, so that you can put it out there. Yeah, please do, because I know usually do it on a Saturday. Saturdays are not good for me, so that's why I'm honest.
Yeah, for a lot of people, you're right.
Yeah, it's Saturday. I mean, if you had 2 sessions, Saturday and Sunday, that would be fine. But you only have Saturdays, so Saturdays, you know, because right now, I worked on it. I have lost weight because I really didn't want no one chasing me for Thanksgiving. I was not gonna be a butterball turkey, so I had to lose weight. So I'm good. So, but I want to lose some more, right? Warren, go ahead.
Yes, I just wanted to remind everybody that tomorrow from, I believe, like 9 to 3 is our fresh market from CB9. And this is from Grow New York City. One of the things that I learned at the last one, because the prices are so low and the produce is so good, is that they're charging wholesale prices. So please get that out the word to everybody. We've had a great reaction to this, and I think everybody should take advantage of it. The second thing I want to say is to
Location, sir,
Rashida.
the location.
Oh, thank you. Empire and Nordstrom in front of the old Associated Market. And that's the reason why CB9 has done this with the borough president and a whole bunch of elected officials. But it's a great thing. So, you know, get people out there. The second thing to Rashida is that I am a senior citizen and I agree totally with exercise. I ride a bike, and if you ever want to put together a biking program with City Bike, let me know. Thank you.
But I just want to say that, Warren, I don't know how much more exercise that you want. You run in my mind all the time.
Yes, I do, but that's just me. My target is 6,000 miles for this year, and I'm going to make it. But
Okay,
I do that as a form of commuting.
okay.
You know? So
You
that's
didn't
me.
get it.
I'm glad you mentioned that because City Bike has that community, well, that's something separate. I don't know if community boards are allowed to do that, but there is a grant program through City Bikes but that's a whole nother.
Yes, Rashida, if you contact Dante, we have a way to work through grants. And we're very
Oh,
happy to do it.
Right.
okay.
Yeah. Let's talk offline about that and we'll see what,
Exactly.
yeah.
Okay, yeah,
Yeah.
absolutely.
All
Thank
right, Miss. Thank you, Enid.
I wanted to piggyback on what you were saying, Ms. Friend, about sometimes the community not really knowing what is really there for them at their hospitals. And Kingsbrook currently, for One Brooklyn Health, has the antibody COVID-19 therapy treatment. And I just want to tell everyone a little bit about what that is, because it's really called scientifically a monoclonal antibody treatment. And it's a potentially life-saving treatment that reduces the risk of hospitalizations and death for COVID for high-risk individuals. The treatment should be given to someone early during COVID, ideally within the first few days after symptoms develop and before they become seriously ill. So the criteria really for those categories are confirmed COVID positive, high risk for progression to severe COVID, symptomatic but not seriously ill, meaning not sick enough to be hospitalized or require increased oxygen support, or not fully vaccinated but have been exposed to someone with COVID, or fully vaccinated but have a weakened immune system from a disease or medications they are taking and exposed to someone with COVID. So the antibody treatment we're finding is working really, really well. And I'm going to go ahead and give a phone number for anybody who might know someone who wants to take this treatment. It's 718-604-3312, and that is to our antibody treatment center.
Thank you so much. Thank you. And that Mr. DM, it is something and information I think that the membership need to know of, from that we should pass it on. It's very important. Go ahead, Warren. Okay, I guess he spoke already. I'm still seeing his hand up. Okay, anyone else have anything to say? Anything? I'm sorry?
I said that was from what I just had to say.
Okay. All right, so I'm assuming that is it. Nobody have anything else to say? All right, so Good information, great meeting. It was a pleasure seeing each and every one of you. I missed you guys, but I know Rashida, she really missed it because I know where you live, you know? So I think the spirit really loves you. So it's good. You know, give your mom my regards, please. Give her my love.
I
And
will. I absolutely
but
will.
don't worry, Rashida, you were not the only one I was going after. I was going after Enid as well. So
Oh
you
my
had
God.
you had company. So don't worry, you had company. I was sending the men in black after the two of you. You know, so I'm happy that you know you all take the time to be here. I'm looking forward to next year. So what's happening next year? I'm looking forward to Monica as to what she's bringing to the community. I'm looking forward to working with Miss Smith as well, and each one of you. I appreciate you. I couldn't do this by myself. If I had to do it by myself, I would be sitting down here and I would be watching myself. And I know I'm that pretty, but not that pretty because sometimes I frighten my own self. So I don't want to be talking to myself all the time. So I appreciate you guys for taking the time off for being here. Let's work together. It's us. So let's do it together. We don't want no broken links. We want all the links to be strong and firm and linked together and stay strong. Let's do it together. Stay safe, keep warm. Love you guys. Have a good night.
Good
Take care.
night.
Bye,
Take care,
good
everyone.
night.
Everyone, good night.
Good night.
Night.
Night.